Welcome back. We have Dr. Raouf here, who is with NVISION. Welcome. Thank you for being with us today.
Thank you for having me.
So dry eyes. I was talking to you earlier. Yeah. I suffer from dry eyes, and it seems to be quite popular. So
it is.
Give me a background of what dry eyes actually is.
Dry eyes is a big term that describes a lot of conditions that fall in between it that basically cause multiple symptoms. Usually people think of dry eye like you just feel like your eyes are burning, but it actually could be several symptoms. Burning, itching, redness of the eyes, excessive tearing could also be a symptom, and this is one that's usually confusing for people because they come in saying, my eyes are tearing a lot, and we diagnose them with dry eye and they think it doesn't make sense, and it is counterintuitive. Oh, wow. But when the eye gets really dry, it just reflects tears and it causes too many tears to fall down the cheek at the wrong time.
Oh, interesting.
A lot of people are impacted by this condition. Unfortunately, over 30 million Americans have some sort or some degree of dry eye.
That is a lot of people.
That's a lot of people.
You know, what are some of the factors of why people suffer from this?
There are many factors. One of them is aging. As we get older, we just don't produce as many tears. So they've done studies where they look at the amount of tear production that we have. And somebody who's 60 years old makes about half as many tears as somebody who's 30 years old. So just naturally, over time, we don't produce as many tears.
Okay.
Another big risk factor is environmental. The air that surrounds us. If it's really dry, for example, in the winter, when you're in a heated environment with ventilation, then that can dry out the eyes as well because it just pulls that fluid, just like how we could get dry skin or dry lips in the winter. And screen time has actually been really implicated with dry eye as well, and I think that's part of the reason why it's becoming more and more common to see dry eye, even in younger folks. When we use screens, which we do most of the time in this day and age, looking at the phone, iPad, or the computer, we just don't blink as much. We tend to stare. And with the eye being open and exposed more, so there's basically more surface area of the eye that's exposed, that evaporates our tears and reduces our eye lubrication.
Okay, all right. And then what's actually happening in the eye? I know we have a picture that shows the eye itself.
It's important to know that there are different components to the tear film. It's not just all liquid. So in this picture over here, I have the actual different layers that you have. And the first one is lipid. So that's actually made out of fat. So it's a lipid layer. And that one is an oil layer that prevents evaporation of the tears. So some folks come in with dry eye not because they're not making enough liquid, but because they're not making enough oil. And whatever liquid they're making evaporates really quickly. So I'll talk more about that in a moment, about what we can do to improve that aspect.
All right.
The second part of the tear film is the liquid one, or the aqueous. That's the water. And that's produced by a small gland that we have near the eye called the lacrimal gland that produces that aqueous layer. That's the tears. Folks who have autoimmune conditions, for instance, rheumatoid arthritis or Sjogren's, can have inflammation of that lacrimal gland and have reduction in the water or the aqueous layer production of their tear film.
Wow, gosh.
Another one is the mucin layer, and that's basically like a mucus layer in the tears that also aids in improving the quality of the tear film so it stays on the surface of the eye longer. So when somebody comes in with dry eye, we do multiple tests in the office, and we try to target exactly which part of the tear film is deficient so that we can target the therapy appropriately.
All right.
So the first therapy that we typically use, if it's just reduction in the liquid or the aqueous part of the tear film, is to add lubricating eye drops. So those are the ones that you mentioned that a lot of folks use in the morning, and it's an over-the-counter artificial tear that basically just supplements whatever tear that we're producing.
So what is inside the tear drops that we're using to help replenish?
So those are just artificial emollients. And there are many different kinds, and a lot of times it's just trial and error to find out which one works best for you. It's really like using lotion. If somebody has dry skin and they use one kind of lotion, they like it, or they use a different one that they feel works a little bit better, it's like that. It is important to note that there are two kinds of over-the-counter lubricating drops. ones that have preservatives and ones that don't. And the ones that have preservatives obviously have the preservative for a reason, because it comes in a little bottle and the preservative prevents any bacteria from growing in that bottle. But I usually don't recommend using those drops more than 4 times a day. Because if you use them more than 4 times a day, then the preservative can actually cause some toxicity on the surface of the eye. So an alternative, if somebody will be using that lubricating eye drop more than 4 times a day, is to use the preservative-free artificial tear, which is also over the counter, so you don't need a prescription for it. And it comes in these little individual use vials. So those are the ones that you crack open, use it once, and throw it away. Those don't have preservatives, and you can use them as often as you want, and they will not cause any preservative-related toxicity to the surface of the eye. Another treatment that we do for dry eye is putting in punctal plugs. So right in the corner of our eyelid, we have a little opening. That opening drains our tears away into our nasal cavity, into our sinuses. And I like to make the analogy of, think of the eye like it's a bathtub, and your tears are the water in that bathtub, and there's a drain at the bottom. And we can put a little plug in that in order to stop the fluid from running out of the eye. So there are a couple of different punctal plugs, and just based on the exam we'll determine which one would be better. There are ones made out of collagen, ones made out of silicone. The collagen ones dissolve after a few weeks, whereas the silicone ones stay there forever.
And what would be the point of having one or the other?
The silicone ones don't dissolve. So if we know that somebody needs these plugs and they will need them long term, then we do the silicone ones. Whereas if we just want to trial them out and see if somebody will benefit from them, then we'll do the collagen. Sometimes, based on anatomy, if the silicone ones fall out of the patient's eyelid, then we'll do with the collagen ones, because they go inside the actual tear duct. So that's a really good treatment, because it basically just allows more fluid to stay on the surface of the eye. So both of those treatments that I talked about look at or improve the quantity of the tear film, not so much the quality. So I talked about the different components of the tear film, so there are some things that we can do to improve the quality. So also within the eyelid, just like how we have that little opening that drains away our tears, we have tiny oil glands. They're called meibomian glands. And those meibomian glands, there's about 20 to 30 of them in every eyelid. They're right by where the eyelashes are. Those produce oil throughout the day that improves the quality of the tear film. And those oil glands can get clogged. Just like how the pores on our face can get clogged, those oil glands can get clogged, and this is a really common condition. And I have a slide in there that actually shows a test that we can do in the office that looks at the difference in somebody's eyelids where the oil glands are open versus when the oil glands are clogged. So on the picture to the left, with the upper eyelid flipped and with the lower lid averted, you'll actually see that these channels, the little white channels, those are open, normal oil glands. And they're filled with oil, and that's why they look nice and full. The image next to it shows severe dropout of these oil glands. So you just see that they're missing. They're truncated, which means that they're shorter, and there's just missing oil. This person is just not having that additional important component that keeps their eyes lubricated. So there is a treatment for this. Usually, as a first line, we recommend doing warm compresses. So getting a washcloth, putting it under warm water, putting that warm washcloth over the closed eyelids, leaving there for about 5 minutes. It really helps the eyes feel better over the long term, because it gets that oil loosened up and it gets it flowing onto the surface of the eye.
Can I ask you a question regarding that? Because a man versus a woman, so women wear a lot of makeup around their eyes, mascara and liner. Does that have any effect on the oil glands?
Of course. So makeup can clog those oil glands, so I always encourage my female patients to make sure that they remove their makeup thoroughly in the evening. And another treatment that we can do as well is eyelid scrubs, which basically just means cleaning the eyelids at the end of the day or just once a day with an eyelid cleaner. There are many that are available over the counter, and some are prescription, that you just use with some water to get rid of any of that debris that can be clogging the oil glands. And it will improve the circulation or the flow of that oil. Another treatment that we do for really stubborn cases where the warm compresses and the lid scrubs are not working is LipiFlow. And LipiFlow is an in-office procedure that takes about 12 minutes to do, where we apply these pads on the the eyelids that apply heat and compression, as you can see in that picture over there. And it's a very effective treatment in getting those oil glands opened up and flowing.
Oh, that's interesting. What is it actually using? Is it like a laser? Or?
No, so it's actually a pad that holds the eyelid like a sandwich from the top and the bottom.
Okay.
And it applies heat
Okay.
and compression, mechanical compression, that kind of massages the eyelid.
That's interesting.
It's very, very effective, and it's painless. A lot of patients actually feel like it's therapeutic, and it makes them feel better right away, almost like getting a spa treatment.
Okay.
And it helps the oil glands start flowing.
How often would somebody have to do that? Is it a one-time treatment or maybe a series of
It
treatments?
varies. A lot of times it ends up being a series of treatments.
Okay.
So I have some patients that come in every 6 to 12 months to get LipiFlow done in order to keep their eyes comfortable. I always give them the analogy too of think of this like getting a thorough dental cleaning at the dentist office, but you still have to brush your teeth every day in order to maintain clean teeth.
Okay.
So every day you still have to do warm compresses, getting rid of the makeup, doing the lid scrubs in order to maintain opening of those oil glands.
Okay, fantastic. Thank you so much for the information. If someone would like additional information, how should they get in contact with you?
So schedule an appointment for a dry eye consultation. And when you come in for that consultation, we will do multiple tests that will measure how much tears you make, the quality of that tear film, and a clinical exam in order to evaluate how dry the eyes are. And then we can come up with a treatment plan to what would be the best effective way to treat this.
Awesome. Well, thank you so much for the information. I really like the ideas that you can go from over-the-counter to the last thing you mentioned, which is perfect. All right, thank you.
Thank you.
Remember, if you want any additional information, you can always contact the number that was on the screen for NVISION or speak to your ophthalmologist about the treatments that can be done. We'll be right back.